In this video, I'm going to show you how you could decrease your knee pain with one movement so you can continue to train and work out. What's up? My name is Dr. Nick Buonforte, physical therapist. So knee pain with training could be a whole host of things, but let's look at the most common thing. A lot of knee dominant movements and strategies tend to spark up the knee issue if you're not ready to take on that stress and that load. So for an example, a forward lunge with your chest staying upright is a knee dominant movement. Wall sits is a knee dominant movement. So when the knee is sparked up in pain and we do these knee dominant movements, it tends to not feel good and it just puts a lot too much load and stress to it. So an alternative that you could do is switch to a hip dominant movement strategy while you're working out and training. That way, the loading to the knee decreases so that you can continue to train, and on the back end, you can start to work on adapting the capacity to withstand knee dominant movements. But let me show you the one movement that I like to use for this modification. So there's many knee dominant movements. In this video, I'm just gonna go over a forward lunge and how we can use a modification for this. So when we're doing a forward lunge, a lot of times when we're lunging forward, our chest stays upright and our knee goes forward. That puts a lot of stress and strain to the knee because it's a knee dominant strategy giving the mechanics. So if my chest is upright, the moment arm from where the center of mass is to the knee is pretty large, and that could spark up some of the knee issues. So a lot of times this is a contributing factor to developing knee issues. One simple modification that is my go-to with this particular movement is simply just leaning the chest forward. That creates an emphasis on a hip dominant movement. So as I go forward into a lunge, if I bring my chest forward towards my knee and I go down, that shifts more of the effort to my hip. So this way you can continue to do this type of motion without sparking up the knee as much in pain. So as my chest is forward, my center of mass is right here, and the moment arm is less to the knee, versus if my chest was upright, there's more of an emphasis onto the knee. So it's just mechanics. Leaning the chest forward tends to do pretty well with this type of movement in lowering or decreasing the knee pain that you might be getting with a forward lunge. So again, we're up here. As I step forward, my chest goes with the motion. I don't step, go down, and then lean. It's as one movement. So I'm here, chest goes forward, and I come back down. And I do feel it more in my hip than my quad throughout this exercise as my chest goes forward. So hopefully you gain some value and insight why it's so important to monitor your chest angle to switch to a hip dominant movement strategy versus a knee dominant strategy that's continuously sparking up the issues and pain you might be having at the knee. Guys, if you did find value and learn some things throughout this training, then I would really appreciate it if you subscribe, like, comment, to leave any questions down below. And also don't forget to turn on your post notifications so you never miss a video when it comes out. Also, if you want to learn a little bit more about programs that I have specifically for this body region at the knee or other regions, check out my website. I'll leave the link in this video or down below in the description. Head right over to the website, check it out, check out some of the programs and how they'd be beneficial for you. And I also have some free guides on there as well. This is Dr. Nick. I'll see you next time.